Hello and thanks for joining me. Today we're going to talk about high blood pressure, and one might wonder, why take blood pressure pills when I feel fine? That sounds like a legitimate question, right? But the truth is, hypertension often lurks silently, masquerading as good health while posing grave risk to your heart and arteries. So join me as I unravel the global challenge affecting millions, shedding light on the hidden dangers of unchecked, sustained blood pressure and the importance of a proactive management for a healthier future. So let's get started. The World Health Organization WHO highlights a sobering reality, estimating that around 7.5 million lives are lost each year due to hypertension. This condition stands as a significant risk factor for a variety of serious health issues, including a stroke, heart failure, chronic kidney disease, coronary heart disease, and retinopathy. So, what is essential hypertension? It is simply a persistent elevation in blood pressure without an identifiable underlying cause, and this accounts for approximately 90 to about 95% of adult cases. In contrast, secondary hypertension arises from specific underlying conditions that leads to a sustained high blood pressure. So I have created a mnemonic using the word cramps, as you can see right here. You can take time to have a look at the list, and this can help you remember some causes of secondary hypertension. It is a simple tool that can make it easier to recall these key factors when evaluating for secondary hypertension. Now, the important thing to diagnose hypertension, the American College of Cardiology, American Heart Association, they define the threshold for an elevated blood pressure as exceeding 130, 80 millimeter mercury systolic, diastolic, respectively, while the European Society of Hypertension sets the benchmark at greater than 140, 90 millimeter mercury systolic, diastolic, respectively. All right, so let's recall together. Blood pressure is determined as a product of the cardiac output and the total peripheral resistance. The cardiac output, in turn, also depends on the stroke volume and the heart rate. Now, various factors can influence the stroke volume as well as the heart rate, and this can affect the blood pressure somehow. So, for example, when checking the blood pressure, it is crucial to stay calm. Let's save the chit chat for after your appointment because the doc is not interested in the latest gossip while trying to hear a heartbeat. So, the various factors influencing stroke volume, for example, speaking of Bell's law, right? Bell's law states that pressure is inversely proportional to the volume. So that on inspiration, when you breathe in, you would increase the volume of the thoracic cavity. That means that you will decrease the pressure in that compartment. And so blood will now rush from the veins into the thoracic cavity because of a decline in the pressures there. That increase in blood to the thoracic cavity would lead to vasoconstriction. Okay, and vasoconstriction would lead to an increased pulmonary blood capacitance so that there is some less, let me say, less blood entering the ventricles at that time. And less blood entering the ventricles means that the stroke volume is also decreased, and this would slightly decrease the blood pressure. Hence, you should stay calm when checking your blood pressure. Okay, another example is a tumor producing aldosterone. So let's say that there is a tumor in the adrenal gland producing aldosterone. This would lead to sodium water retention, and this would increase the volume of the vascular compartment. When the volume increases, it would increase the blood pressure. So it is not uncommon to see hypertension in hyperaldosteronism. When that blood pressure increases the flow to the kidneys, this would certainly suppress renin levels as well. Okay, heart rate can also impact cardiac output, particularly in cases of sympathetic nerve activation, like in pheochromocytoma, anxiety, or even a white coat syndrome. All right. Additionally, peripheral resistance can be affected by blood viscosity. This may be related to conditions such as leukemia, polycythemia, multiple myeloma, among others. Occasionally, medications may be the cause of an elevated blood pressure, hence, a comprehensive drug history must be taken. So, in general, the doctor would run some baseline evaluations encompassing the patient's history, physical examinations, and laboratory results. These are all vital, ensuring that blood pressure is not merely viewed as a number but understood in the broader context of the individual's health. To diagnose hypertension, most guidelines emphasize the importance of obtaining at least 2 to 3 separate office measurements on at least 2 separate occasions. This allows clinicians to consider key factors such as individual risk factors, concomitant disorders that may influence blood pressure, and the presence of target organ damage, ensuring a comprehensive assessment for effective management. So here we're going to explore the grades of hypertensive retinopathy, which reflects the degrees of damage caused by a sustained high blood pressure. So in grade 1, we observe a thickened, narrowed, tortuous arterioles, which gives that silver wiring appearance, as you can see right here. As it progresses to grade 2, arteriovenous nipping occurs where the hardened sclerotic arteries compress the veins, and that will happen in areas like this where the arteries crosses the vein. Okay, we call it AV nipping. Grade 3 reviews more significant changes, including the presence of a flame-shaped hemorrhages, as you can see right here. Okay, these are flame-shaped hemorrhages. And there are also hard exudates, as you can see right there. And cotton wool spots can also be noticed. And in short, these are all indicating further retinal damage. In grade 4, we see a critical condition known as papillary edema, where there is swelling of the optic disc, highlighting the severe impact of hypertension on the eye. In managing essential hypertension, both the American College of Cardiology, American Heart Association, and the European Society of Hypertension guidelines emphasize the use of polytherapy, ideally in the form of a single pill combination. Based on this, it is recommended to prescribe 2 or more antihypertensives simultaneously, okay, to achieve optimal blood pressure control, targeting levels below 130, 80 millimeter mercury, that is systolic, diastolic, respectively. A common regimen involves a combination of ACE inhibitors, ARBs, thiazide diuretics, and calcium channel blockers. While the American College of Cardiology, American Heart Association recommends reserving beta blockers for patients with coexisting ischemic heart disease or heart failure, the European Society of Hypertension suggests them as a first-line option. For diabetic patients, ACE inhibitors or ARBs are particularly beneficial. ACE inhibitors can sometimes cause bothersome dry cough. In such cases, they can be replaced with ARBs. It is important to note that standard thiazides like hydrochlorothiazides can adversely affect lipid, uric acid, and glucose metabolism. Additionally, while amlodipine is effective, it can lead to peripheral ankle edema, and this should be clearly communicated to the patient. It is also crucial to assess lipid profile if there is the need to introduce statins or fish oil alongside antihypertensive therapy. And do not forget to rule out secondary causes of hypertension. Non-pharmacological strategies also play a crucial role alongside medications, emphasizing the importance of lifestyle modifications such as weight management, reducing salt intake, moderating alcohol consumption, quitting smoking, and maintaining physical activity. Bear with me that essential hypertension is a chronic condition that cannot be cured that can be effectively controlled. Many patients may be asymptomatic, leading to misconceptions about the need for ongoing adherence to medications. However, achieving target blood pressure levels requires continued compliance with prescribed treatments to maintain control and prevent complications. Remember, stay healthy. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.